Have you ever sat in and observed with a really great practitioner and were wondering, well, why did they do what they were doing? You might even have asked them afterwards and they're like, well, I don't know, it was just kind of gut instinct. Now, gut instinct isn't really helpful for us to understand what's going on, or for you if you want to get closer to that place where that great practitioner is. And so today I want to do a little brain hack for you to kind of break this apart, to analyze it for you so you can understand what's going on with it and you can train your brain to get like that great practitioner. Because what we have in the system, in our body, we have two pattern recognition systems that are going on that help us make decisions. There's an extrinsic and an intrinsic decision making. Now what happens is when we're using that extrinsic, it's like that cold logic, it's our frontal cortex, it's going, right, well I'm going to do this and I'm going to do that and I'm going to do that. And there's certainly nothing wrong with that decision making process, it's a good one. But it's that intrinsic system, that intrinsic pattern recognition that actually some more of that magic goes on there. And what they've been shown, neuroscientists have shown that what happens is that when you have neurons that are firing much further apart, so there's the kind of connections that are coming from disparate parts of your brain, and they enable you to make that leap of more than logic. So it's when that chess player does that amazing move, when the musician just decides to do something with the guitar or the violin that you're like, wow. And it's when that health practitioner just has that gut feel to do something. It's not really a gut feel, it's not coming from their gut, it's coming from their brain, but it's using a slightly different system. And what happens when you first start as a practitioner, you're in that cold logic because you don't have that much experience. I'm going to do this and this and this because that's what I was taught. And so if you can switch yourself a little bit from that extrinsic to the intrinsic, that's when you get that leap, and that's when you get that leap in terms of your ability to get much better improvements in terms of patience. Now you don't throw out the logic, but you just ability to tune in with this other system as well. And the brain hack that I'm going to give you for this is that you simply, what you do is you ask a question. So you might simply ask a question out loud or to yourself. So if you're working on the low back, you might go, I wonder what, internally, I wonder what would happen if the sacrum acted as 5 pieces, not as one bone. Or I wonder if that ligament there was doing this or that. So you're asking this logic question, and then what you have to do is just relax and let go a little bit, which is pretty easy to do sometimes when we're with patients, is you just let your hand relax a little bit. And that's why waiting often will get you that kind of, you ask a question and then you pause and you do nothing, seemingly do nothing, allows the body to relax and get that intrinsic system going. So there's the two things. So you ask the question, which is kind of a little bit logical side of the brain, and then you wait and you relax and you allow that intrinsic part of your pattern recognition to come to the fore and to aid you and get to that intuition, or if you like, that gut feel. So whichever way you currently work, I really encourage you, give this a go. It'll cost you nothing. You're saying that question internally anyway, so the patient's not going to think you're weird. You're waiting for maybe 20 seconds at most. So give it a go. I think it'll make a really big difference to the way you practice and the way you develop